again, do you think that, I've always been impressed by your family support. Do you think that that's where a lot of that comes from, Anne, or do you think that's from, because again, this is the first time that we had met was when you felt this. Has this been something that's been, consistent as you went along for your whole life?
Yeah, I think I've always been positive. I think I've always felt like I'd accept any challenge that they raised, even in my career. And to me, this was a challenge. This was my own personal health challenge. I was going to get through it. And that's how I've always been. Yeah, I don't think it's just something new to the fact that, it was a health issue. I've never had a health issue before. This was the first time. This was the first time I've ever even been in a hospital other than having my daughters. So it was really all new to me. Of course, I made up for all those years of not being in a hospital because they got to know me very well at Northwestern. But yeah, I guess it is my attitude. But I really do think that a lot of it was, the biggest part was my family support and you, Dr. Meeks. Dr. Morgan's at that time, I didn't know. But Dr. Meeks, you really got us through this. And, I think that was it. I think you need a very supportive doctor, but I also think you have to have a lot of faith in your doctor, which of course I do. I do, and I always will. So I'm sure that's what got me through this.
So then Darrell, on your side of it, how was your experience and what did you do to, what was your support like and how did you come to make decisions and really try and just power through all of this?
Well, I'm intensely independent, and at diagnosis, my belief was we're going to get through this.
Yeah.
And I've always been that way. I manage major projects professionally, and projects have ups and downs and challenges, and I was leading one of the largest programs at work at the time. So it was like, okay, this is just another hiccup with me that just has to be surmounted, and we'll just go forward. This is part of the journey. And you and I have talked about positivity and drive. And I think that is critical to any patient diagnosed with a major health challenge.
I think the family support is really, well, for me, it was the biggest thing. I mean, and Dr. Morgans and Dr. Meeks both know that no sooner did I get home from the hospital, our 3-month-old grandson was coming to stay with us. And at the time, our granddaughter was 4 and our grandson was 2, and they were coming over after school. And a 2-year-old stay with us. And that's what I wanted. It wasn't like I could play with them or do anything. I just knew they were there. They were having fun. They were playing. My husband was taking care of them and me. And that did so much for me. It just made me feel like, okay, this part of my life is normal. We'll get to the next step.
Right.
And I did. Eventually I was in the schoolyard waiting for them to come out of school. It was just goals I set for myself. Dr. Meeks told me it would take about 3 months to get back to normal. And it took me about 6 weeks. In my opinion, I felt normal. I went out to dinner 6 weeks later. Yeah. I was at the schoolyard 6 weeks later, and I was feeling good. To me, it was a great thing to be out there with other people. And that's what I wanted. And that was my goal.
Now, you've both been very, you've talked to other patients who are trying to make those choices. Looking back through your own journey, where did we go wrong? Where do you wish that we would have done a better job? Or what do you wish you would have known, knowing what you know now? Like trying to look backwards, where do you wish you had more information or had a different perspective? Is there something that that could have been told to you or that you said, oh boy, that was not what I thought was going to be like?
For me,
go ahead. I don't think there's anything that I could have known before. One of the things I do wish that, not just me, that I think is more well publicized should be bladder cancer. I mean, I've always heard, breast cancer, colon cancer. Those are the ones you hear about all the time. Those are the ones you read about. So-and-so had this. And bladder cancer to me was like, I had never really even heard of it, never thought of it, probably never heard of it. And I think I wish it had been more publicized, not publicized, but where I would have heard more about it. So to me, it was a total shock because I thought I was going in for prolapse surgery, and I ended up, not having my bladder. But I don't think there was any more that you could have done as far as, I think you educated me really well with that. Like I said, I went on a Northwestern site. I learned and really a lot about the bladder and about what happens, and that was a lot of information for me. And that was fine. I don't know what else could have been done before, unless I knew more previously about the cancer itself.
I don't believe didn't have the opportunity to really speak to anyone before.
No, because you did tell me that, ask me if I would, and I thought, I said yes, it would be a good idea, but obviously you couldn't get anybody. So I really couldn't talk to anybody who had this before. I didn't, to be honest, I really didn't even know that many people that had cancer. A cousin of mine had just finished the year before with breast cancer, but that was it. I really didn't know much about the treatments, luckily it doesn't run in our family.
Darrell, what were you going to say?
So I wish I had known more about the options. So I was pretty much advised that I would end up with an IC purely because I'm a diabetic. But even today in 2020, we have so many more options, including bladder sparing, that I sometimes wonder how life would be different. So having much more education or the ability to tap into, and Beacon's great about having that information easily available, even in other webinars that are on their site as well.
I guess I can't, now that I think of it, I can't say that I didn't know anything about cancer because my husband had colon cancer a few years before. Mm-hmm. Again, he didn't go through chemo. He had surgery done. And believe it or not, 2 weeks later, he was at work. So, I guess I just followed in those footsteps, like I did what he did. I felt like I can keep on going. And maybe he's part of the reason why I have this positive attitude towards it. He got through it, I could get through it.
So I think, the positive attitude is so important. That's important for kids when they're going through school. When they get something wrong, they have to get up and try again. It is equally, if not more important, when we're adults and we face some of the biggest challenges that you've had to face. And so I really appreciate you talking about the things that you had in your life to draw from, whether it was personal, you're just who you were while you're working on these projects. This is just another hiccup. I'm just going to keep on rolling. And that's fantastic. Yeah. Or whether it's, your family, whether it's your loved ones, whether it's places like Beacon where you can kind of come to at least find information. As we continue, there are a lot of questions coming in, just trying to understand a little bit more about each of your personal stories, because, at the point where you are now, you're looking back, it seems like, oh, I just had this, I just had that. But can we walk through each of those just a little bit more so that people can understand it wasn't just, oh, last week I did this, and then this week I'm off, running to pick kids up and running this project. You guys went through a lot. And so this resilience that you had is really clearly coming into play. Darrell, can you just walk us through diagnosis? What happened then, and explain also, what's an IC, what's an ileal conduit, so folks, if they don't have such experience, can really kind of understand.
Sure. So my initial visit was October of 2016 with the urologist. My CT was early November. MRI was the week after. That's when the final diagnosis happened. My TERP was like December 2nd, and that's when it was diagnosed as muscle invasive with the carcinoma in situ and with squamous cell differentiation. And after that was when we chose the course of chemotherapy. So I got to meet with the oncologist at later in December, and we weren't sure which course I would go through.
Mhm.
So I ended up with dense dose MVAC as treatment, and then post chemo, I had another cystoscopy to see if the chemo had worked effectively. And his observation was he expected white scarring in the tumor area. Instead, he saw pink. So that's when the recommendation of going ahead with the cystoprostatectomy. And early on in the course of treatment, they saw that the prostate test that they did showed a high propensity for prostate cancer as well. So that's why I ended up with a possible I ended up with a cystoprostatectomy. And then
that just means they took out your bladder and your prostate, which is probably the most common combination for men. Sorry, I just wanted to make sure we put that into non-medical terms. You're like a doctor now, Darrell. You know all these terms. Anyway, keep going.
You should have seen me trying to spell that as I was going through it. It was laughable. Thankfully I had a skilled surgeon, Dr. Meeks, that was able to do nerve sparing. So, that's kind of important to us guys. Since then, I went back to work after 4 weeks. And I had actually the day after surgery, I was on a conference call with vendors in China because they were so incompetent. But, it's that drive that, I had to get well.
Yeah, absolutely. And I cannot believe, I hope you were not on pain medications on that conference call, but either way, I guess you got through it, right? And you were better equipped than them, it sounds like.
Yep.
Very good, very good.